Coming up, Cameroon is tonight receiving over 391,000 Oxford ASTRAZENECA vaccines as the fight against COVID-19 rages on. Right ahead, we find out who is eligible for the vaccine. Cameroon's military erects a dismantleable tent to improve service delivery on the border with Gabon and Equatorial Guinea. Civil servants say they are now happy. And the National Mining Corporation, Sona Mines, goes operational at a time when Cameroonians are asking why they live in abject poverty in a land of plenty. The details now. Thanks for watching the 7:30 news on CRTV. I am Moki Edwin Kinzaka in Yaoundé.
I urge you once again to put on your face masks, to wash your hands regularly, and to consult a physician or any other health personnel if you notice any symptoms. This is the only way to save lives and to curb the spread of the virus.
A consignment of 391,200 Oxford AstraZeneca vaccines is expected at the Yaoundé-Simalène International Airport this evening. It will add to the 200,000 doses of Sinopharm vaccines that Cameroon received from China last week as the country steps up efforts to stop the ravages of the coronavirus. Officials of the Ministry of Public Health are on hand to receive the vaccines. Let's meet Kilian Dandifon at the Yaoundé-Simalène International Airport with updates. Kilian, what's new there?
Moki Edwin Kenjeka, all our viewers in Cameroon and around the world, you are welcome to the Yaoundé International Airport in Simalène here, where we actually are standing here in the room where the second vaccine has received. Here it has just landed in Yaoundé and the tarmac here about 25 minutes ago, and modalities are going on to offload the 391,000 doses of AstraZeneca vaccine that will be received here by the Minister of Public Health, Manauda Malachi, who will be accompanied. They are waiting in the VIP room upstairs. They will come immediately. The door is opened here for the cartons of 391,000 AstraZeneca vaccines here, and immediately they are handed over to the authorities of the Ministry of Public Health. They will be distributed from the airport to the various regions where they will be used, and we have these statistics here. We have the Adamawa will have 17,000, the Central region will have 89,500, the East region 17,000, the Final region will have 51,000, Littoral region will have 17, North region 31,500, Northwest region 23,500, West region will have 30,500, South region 15,500, Southwest region 25,000 doses of this vaccine, and we will still have over 19,000 reserves in case they need or some of them get problems. Just to note here that the reception, official reception here will be done by the Minister of Public Health, who is accompanied by the head of the European Union delegation, the ambassador of the United States to Cameroon, and we are having this at a time. The figures of coronavirus are rising in Cameroon like elsewhere, and we hope this is going to be followed by Johnson & Johnson, also on the list as Sputnik 5 that are announced for next week or the days ahead. Kilian Dandifon reporting live from Yaoundé International, Simalène International Airport.
Thanks very much, Kilian Dandifon. We shall be expecting updates anytime you call in the course of this newscast. The Oxford ASTRAZENECA vaccine is reportedly 76% effective at preventing the coronavirus. Its efficacy level among severe cases of COVID-19 is 100%, and people above 55 years view it as a food vaccine, a true vaccine. However, ASTRAZENECA has been associated with undesirable effects such as blood clotting. Beatrice Losamba reports on the dynamics of the vaccine.
The UK Oxford AstraZeneca vaccine, supplied in over 140 countries, including Cameroon, uses familiar vaccine dynamics, the viral vectors.
Once injected into the humans, then it instructs the cells on producing the vaccine, and then you react against it by producing an immune response against it.
With its 76% efficacy rate, the vaccine is reportedly effective in preventing COVID-19, especially among people above 55 and high-risk groups such as frontline health workers.
And up to 100% efficacious in preventing severe and critical disease and hospitalizations and death. For those who are less than 18 years, there is no data yet that shows the efficacy and safety of this vaccine.
And there have been even more speed breaks on the way to the vaccine success. Recently, it was associated with serious undesirable effects.
Some severe side effects that occur very rarely among 1 million people who have been vaccinated with this AstraZeneca vaccine.
Also found effective against new variants, and given that the benefits of the vaccine outweigh the risks, the population is advised to follow relevant country advice and go for the AstraZeneca jabs.
Several treatment options have been tried against the coronavirus with little success. A vaccine scientists say is proven to be the most effective in controlling the deadly viral outbreak is therefore the most promising option against the coronavirus. The population can get the vaccine to protect themselves and their family and loved ones, experts are advising. Beatrice Losamba reports on the advantages of the COVID-19 vaccine.
Generally, vaccines are known to protect from very serious and potentially deadly diseases, and the COVID-19 vaccine is not an exception.
Some of those affected with COVID-19 have very severe outcomes, especially those with underlying diseases. COVID-19 vaccine helps us to reduce the severity of these outcomes.
To understand the dire need for a vaccine, it is important to call to mind the damages this disease causes.
COVID-19 is what we call a multi-systemic disease. So, other than the lungs, it affects many other organs like the brain, the heart, the kidney.
Several treatment options tried in the past having failed to deliver much success, science flaunts the COVID-19 vaccine as the most promising option now, and people are advised to take the vaccines proven safe to protect themselves and loved ones.
You getting the vaccine does not stop you from getting the virus, and it doesn't stop you from infecting others, so you can still transmit the virus. Still, always remember to wash your hands with water and soap. Try to avoid crowded places.
Advice worth heeding to stop this global enemy.
Ever since Cameroon received its first stock of COVID-19 vaccines, the population has been uncertain of who is eligible to be vaccinated. According to the Deputy Secretary General of the Expanded Program on Immunization, Dr. Njo Andreas, only those who are 18 years and above qualify for the vaccination. Details with Yoti Kalili-Songe.
A beacon of hope to many installing the coronavirus COVID-19 vaccines. It has been a subject of conversation ever since 200,000 doses of the Sinopharm COVID-19 vaccine touched down in Cameroon, as many wonder who can be inoculated.
Vaccination has begun with the higher risk group, the frontline health workers, and with the goal to enroll the elderly, 50 and above, and persons with underlying health conditions. So I think the hope is that once these have been vaccinated, with the coming of more vaccines, the entire population someday will be recruited. It is voluntary, but we strongly encourage the population to get vaccinated. So far in Cameroon, we have been able to vaccinate increasingly up till today, more than 2,000 persons.
Research is still ongoing to determine the fate of people under 18.
These vaccines are indicated for persons 18 years and above. So for now, those younger than 18 are not yet being enrolled.
It remains a useful rule of thumb to respect all COVID-19 barrier measures.
Today is observed as the World Hemophilia Day under the theme Adapting to Change, Sustaining Care in a New World. On the occasion, some patients of the disease that is usually an inherited bleeding disorder in which the blood does not clot properly and their family members attended a conference in the nation's capital. Cynthia Saptala has the details.
Hemophilia is described as an inherited bleeding disorder in which the blood does not clot properly. Based on medical information, it can result in bleeding within joints and cause chronic joint diseases, bleeding in the head and sometimes in the brain, which can cause seizure and paralysis, and death if the bleeding cannot be stopped. In Cameroon, health professionals say there are more than 1,500 cases, but only 200 are known and follow treatment.
Most of them are not aware that bleeding disorders may be hemophilia. We think that we need to educate those families. Thanks to the World Federation of Hemophilia and University Teaching Hospital, we have now a center, a treating center that provides free of charge care to hemophilia patients. We are now working on new drugs that may prevent the bleeding in the future.
According to medics, early diagnosis makes it easier to manage the disease and lead a healthy lifestyle.
We are diagnosing that disease very early in life, at 2 years, 3 years, 4 years, and it's mostly the boys. The most important is to diagnose it early and to make sure that you are follow up regularly to prevent the bleeding.
With this year's theme centered on adapting to change in the context of the health pandemic, the roundtable conference organized in Yaoundé with families was to educate them on the new treatment possibilities and how to manage patients at home.
The new Bureau of the National Opticians Board of Cameroon has been officially installed with Douanla Solange Veneranda, the helm of the association. Their 2021 elective General Assembly ended in the nation's capital, Yaoundé, today. Victor Siga reports on the challenges ahead of that association.
Amongst the missions of Douanla Solange Venerand, safeguard the interests of members and promoting the growth of the association through the creation of income-generating initiatives.
The optician profession is one of the new profession in the health sector. It has a lot of challenges, probably like the clandestine practice. To help to modernize the practice, we need that they should put in effort.
She is the first lady to be at the helm of the organization, and she is aware of the challenges awaiting her.
We have to work on our legislation. We have to communicate, teaching Cameroonian why you have to go to the optician.
Douanla Solange Venerand takes over from Bega Theodore, founder of the association and president since its creation in 1999.
School authorities in the Central Region have been given tools to implement distance learning efficiently. During a workshop in Yaoundé, the Minister of Secondary Education, Professor Nalova Lyonga, said distance learning will help solve the current COVID-19 spread. Let's listen to Dr. Waka John Berry, who is in charge of distance learning at the Ministry of Secondary Education.
In the last 2 weeks, that is the special session that was organized by the Minister of Secondary Education, we had over 2,000 participants for our distance education. So this workshop is to let the education community for the center have a grasp of what they are supposed to do. Distance education has just come to complement and to add on to the time that are being lost because of the two-shift system. The teachers have an interactive session with the students, even though they are not touching their teachers, but they are learning.
Cameroon is said to be endowed with vast mineral deposits such as gold in the east, bauxite resources in Gaoundéré, aluminum smelter in Idea, etc., etc. Yet Cameroon has not been able to tap from its God-given riches to power its economy. Cynthia Saptola in the following report says among the challenges to be handled is anarchy and corruption.
The lack of a clear regulatory framework has led to the entrenchment of bad practices within Cameroon's mining sector. From the absence of mining licenses to illegal exploitation and transportation, according to the Artisan Mining Support and Promotion Framework, the Cameroon Public Treasury loses about 1 billion CFA francs every month due to the concealment of resources produced by mining companies. Another major obstacle is the exploitation by non-nationals, whereas the 2016 mining law only permits local artisanal miners to search for gold using rudimentary equipment. The use of semi-mechanized machines by such unauthorized companies have been known to alter the landscape significantly and affect the environment. The recent creation of the National Mining Company should develop the sector while manage states' interest in the field.
The creation of the National Mining Corporation Sonamines by a presidential decree has been welcomed by operators and the mining sector, as it is expected to promote exploitation and the sale of minerals in the country and boost the economy. Luma Slim Davis reports.
The state coffers benefit from billions of CFA francs generated in the mining sector. Several thousands of jobs are also put at the disposal of Cameroonians.
Sonamines is going to gather all the gold produced in Cameroon. Gold is produced in Cameroon artisanally, is 300 kilograms per month. You know, if you take all that gold, you will not sell it. You are going to put it in the bank, and then you are going to raise money, the state, and then we are going to forget what they call emprunt obligataire. 300 kilo of gold is more than around 10 billion. And then if we organize more the activity, we are going to reach the 500 kilogram of gold per month.
There is therefore a dire need to organize properly and regulate activities in the sector, and this is one major activity of Sonamines.
Sonamines will be involved in all the sectors of the mining, from exploration to exploitation to treatment to transformation and to commercialization.
Sonamines is expected to ensure follow-up of security in the sector, oversee sales, and the respect of international conventions, amongst others.
The people of Baimboum in the North region have been advised to collaborate with the military to root out transborder crime and insecurity. The General Coordinator of Cameroon's elite force, the Rapid Intervention Battalion, Colonel Pelaine Francois, spoke while inaugurating a border base of the troops in Baimboum. Wilson Mengole reports from Garwa.
Baimboum, a locality in the North region sharing borders with Central African Republic and Chad, is a commercial hub with a flourishing cattle market. It is against this backdrop that a Rapid Intervention Battalion unit of the 4th and 5th Intervention Base has been created to counter the activities of this transnational crime syndicate.
The construction of this base, it is a participatory approach of the state on Cameroon's border defense policy, which is a process of constructing 8 defense bases along the boundary. The importance of the border international market that was here, that doesn't really prosper today because of the security situation.
The base consists of 100 standby soldiers with modern equipment for transmission, lodging facilities for prompt reaction.
The base is constructed for the population, and that the population has to use it for its own security by providing the necessary information for the forces.
The goal of the 4th and 5th Rapid Intervention Battalion unit is to keep the population of these localities and their property out of harm's way.
The International Federation of the Red Cross and its partners have launched a new program for humanitarian response to communities affected by the Boko Haram terrorism in the far north region. The initiative, which provides a rapid response to pressing social needs, was launched in Marua in the presence of local authorities, beneficiary groups, and humanitarian workers. Sylvester Atemken reports from Marua.
In response to the growing need for humanitarian assistance in some localities of the Far North region affected by Boko Haram atrocities, the Japanese government and the Red Cross Federation and Red Christian Societies have established a partnership for health and sanitation promotion.
Improving the health and hygiene conditions of these vulnerable populations, support for health centers by strengthening their logistical capacities, promote access to health care for children under 5 years old, training on the integrated management of acute malnutrition.
During the launch of the project in Mora, the Red Cross staff highlighted some priority projects with the most urgent need for the displaced people being access to clean water.
We have to construct one borehole, rehabilitate 4 others, and also construct toilets, not leaving out the hygiene sensitization campaign.
For the next 6 months, through this joint action with funds from the Japanese government, over 500 million francs, the project will support over 40,000 vulnerable people in Mayo-Sava division with a complementary health and wash intervention to reduce incidents of malnutrition and the spread of various diseases, including COVID-19.
A makeshift tent recently installed by the Cameroon military to lodge the services of government workers along the Cameroon-Gabon-Equatorial Guinea border has been handed over to the SDO of the Ntem Valley, Buba Haman. Brigadier General Simon Ezom Vondo, commander of the 1st Combined Military Region, enjoined the beneficiaries to make good use of the facility by rendering quality services. Details with Darish Alenui.
No more wooden huts, no more plastic tents. The awful experience is usually lived by officers of the police, gendarmerie, customs and phytosanitary workers, as well as the population and business persons at the border localities of Kiosi. Brigadier General Simon Ezomvondo, commander of the 1st Joint Military Region, representative of the minister delegate at the presidency in charge of defense, handed over the structure amidst calls for the services concerned to make good use in order to attain the purpose for which it's meant. These tents are aimed at improving your working environment. With these facilities in place, we are going to demand more from you. The senior divisional officer of the Ntem Valley, Buba Haman, has appreciated the initiative, saying it is timely. With the advent of these facilities, we think that the personnel in serenity and professionalism, as required, will carry out their duties. The makeshift tent, which spans on a 200-meter square surface area, will bring together the different control units, hence facilitate the movement of persons and goods along the Cameroon-Equatorial Guinea and Gabon corridors.
Mrs. Abui Anthony Marie Jubilé Mendua has officially taken service as the new Director of Insurance at the Ministry of Finance. The Director General of the Treasury, Financial and Monetary Corporation, Mo Sylvester Tangongo, reiterated the need to put order in the insurance sector. Ewan Epole reports.
Newly installed Director of Insurance in the Ministry of Finance, Abui Anthony Marie Jubilé Mendua, was appointed by the Prime Minister on April 12, 2021. Presiding over the installation ceremony, the Director General of Treasury, Financial and Monetary Corporation in the Ministry of Finance recommended how to put order in the insurance sector, already witnessing some challenges.
As the new Director of Insurance, and that is after the departure of the previous person, Mr. Ezo, who was appointed as Secretary General of CIMA in Libreville. When you talk about insurance in our country, a lot of people have a very negative image about insurance. But more and more, there are a lot of actions that are being taken to improve. You have these direct payments which can be done in case of an accident through a mutual agreement. We also have the new reinsurance company. The government is trying to create a new reinsurance company.
Madame Abui Anthony Marie Jubilé Mendua served in a related service of the department as Deputy Director before the appointment.
Despite our efforts, COVID-19 plunged many families into mourning and seriously hampered the functioning of our economy and society.
The Minister of Public Health has set up vaccination centers to ease inoculations as many more COVID-19 vaccines are received in the country. For more on the functioning of the COVID-19 vaccination centers, let's join Baldwin Sama at the Public Health Emergency Center.
Good evening and welcome. Indeed, it remains quite important for Cameroonians in the different regions for the country to know how many vaccination centers are available and the number of health professionals put at the disposal of these different vaccination centers to administer the available vaccines to Cameroonians in need. And we have a total 343 different vaccination centers in the 10 different regions of Cameroon, with 243 fixed vaccination centers and 330 mobile vaccination teams. Mobile vaccination teams made up of different health professionals. And the region with the highest number of vaccination centers happens to be the central region of Cameroon, with 45 vaccination centers, having equally 45 fixed vaccination teams and 54 mobile vaccination teams, mobile teams that will be moving from neighborhoods to administer the vaccine. The central region is closely followed by the far north region with 33 vaccination centers and 53 mobile vaccination teams in the far north region of Cameroon. And we equally have the littoral region of Cameroon with 32 vaccination centers and 37 mobile vaccination teams. These teams that will be quite busy, already quite busy, trying as much as possible to administer the vaccine to those in need. Back to you.
Thanks, Baldwin. The girls' dormitory of Presbyterian Secondary School Bafut, lodged in Presbyterian Secondary School Mancon, that was torched in January, has been renovated and equipped. Bafut Council Mayor Lawrence Ngwakango led influential sons and daughters of Bafut who helped his council to renovate the dormitory to PSS Mancon. Sylvie Banta reports from Bamenda.
Early January 2021, Presbyterian Secondary School Bafut and Presbyterian Secondary School Mancon, all lodged in the same campus, were reduced to this state. Months on, the image has changed. The affected female dormitories have been renovated. It is the result of collective and voluntary funding by the Bafut Council and key personalities of the municipality.
We brought in beds. We have painted the rooms, we have renovated the floors, even the just automatically the ceilings, just to name this few. We have just transformed that dormitory into a new one. The things that the stakeholders brought in, the school, they have used it their own judicious way, but the council too has come in with the financial assistance, material, and the technical expertise to see that the dormitory is brought back to life.
While handing over these COVID-19 preventive kits to the students, Honorable Oliver Agor of the Bafut-Tuba constituency and Mayor Lawrence Ngwakango also promised scholarships to best 10 students of PSS Bafut and Mancon during the 2021 GC examination session.
The Cameroon Football Classico between Canon Yaoundé and Tonnerre Clara Club has ended in a goalless draw at the Amadou Ahidjo Stadium. The match played this Saturday counted for the 7 games of the Elite 1. It was Canon who had most of the goal-scoring opportunities, as Daniel Ekonde reports.
The rain-drenched match at the Amadou Ahidjo Stadium presented an opportunity for Canon and Tonnerre to set themselves apart after last season's draw. Tonnerre, from a degrading 7th position in Group B, were the ones who started off the incursion from an Yves Elundu set piece parried over by keeper James Njayoyang.
Il était vicieux. Il était vicieux ce ballon.
Bakum hit back with a 23rd minute sliding effort, which shotstopper Patrice Belemp stood up to the challenge.
Aïe aïe aïe! Le tir qui trouve le portier.
Then a header on 45 minutes, but it wasn't enough to give them the halftime lead. Halftime closed in with cause for concern for coach Minkrio Biwe's men, who sucked in 2 goals from Cotton Sport in their previous game and were looking to move up from 3rd in Group B. The second segment didn't present much as Canon continued to misfire. A 66th minute opening in the box is diligently put out by Tonnerre's defense. Centre forward Eve Elundu then found a man in the box, but his inability to strike strike at once caused a clearance in the last quarter. A breakout only produced a similar moment of missed opportunity to defiantly force another goalless draw in their last 2 meetings in 2 seasons.
Cameroon will host the 6th edition of the Islamic Solidarity Games in 2025. The decision was arrived at yesterday during a meeting via video conferencing of members of the Association Executive Council. Cameroon emerged successful out of 4 countries that applied to host the Games. Baldwin Sama reports.
It would be another opportunity for Cameroon to showcase her organizational prowess. Organizing the 2025 Islamic Solidarity Games will see thousands of athletes from different continents tussle for available medals in both collective and individual sports while in Cameroon.
We got the approval of the president to bid for that event, and the Minister of Sport and Physical Education supported very strongly the initiative. And we, at the Olympic Committee head office, we prepare the presentation to show how Cameroon has the ability to host that event.
Out of 4 countries that opted to host this competition, Cameroon stood out tall thanks to our sports diplomacy, a conducive sports environment, and especially available sports infrastructure.
Our presentation certainly was the best. And then Cameroon is known as a sporting nation. All the members of sports in the world, they know Cameroon because they're football, but also because they're leadership.
The 2025 Islamic Solidarity Games will be the first ever international multi-sports competition Cameroon will be organizing, and the country gets ready to extend a hand of friendship to all the participating delegations.
And just after this newscast, join CRTV's chief international correspondent Charles Ebune on the CRTV All News channel CRTV News for a special program dedicated to Prince Philip, the husband of Queen Elizabeth II, who was buried today in London. CRTV News is on channel 306 on Canal Sat. Don't miss that appointment with Charles Ebune. And that's where we end the 7:30 news on CRTV. I am Moki Edwin Kinzeka in Yaoundé. Thank you for watching.
I urge you once again to put on your face masks, to wash your hands regularly, and to consult a physician or any other health personnel if you notice any symptoms. This is the only way to save lives and to curb the spread of the virus.
CRTV News, ici, toute l'info.